Welcome to the Healthy Perspective Podcast with your host, chiropractor, entrepreneur, mentor, and author, Dr. Chris Bowman. He'll break down and extract the secret sauce behind his own success and the success of some of the top leaders in every category and from around the world. Get ready for your weekly mental adjustment because shift is going to happen.
Hello, everyone. Welcome to another episode of the Healthy Perspective Podcast. Today is going to be one where you might want to brush your teeth afterwards. You're going to be checking your tongue. You're going to be doing some exercises. It's going to be a super interesting episode from an angle that most people just aren't thinking about. We have Miss Karese with us. She is a registered dental hygienist and myofunctional therapist. She founded the Myospot, a practice aimed at amplifying oral wellness to whole body wellness. Through Teletherapy, she helps clients of all ages overcome tongue ties, TMJ disorders, sleep apnea, grinding, anxiety, and various breathing and oral facial dysfunction. Passionate about education and self-help, she's published Accomplished: How to Sleep Better, Eliminate Burnout, and Execute Goals. When not working with clients globally, she spends time with her husband and 4 kids. Karese, thank you so much for joining me.
Thank you for having me. I'm excited to be here.
I'm excited to have you. We were just talking a little bit behind the scenes before we started recording about my experience with kids, infants having more tongue ties than I've ever felt, diagnosed, seen in my whole career. This is going on my 7th year as a pediatric chiropractor. I go through numerous boxes of gloves a year, and only now, well, maybe in the last year, am I starting to find more and more commonly, lip ties, tongue ties, buccal ties, or buccal ties, however you say it, more TMJ, more anxiety. And I got to think that it has to boil down to, people are stressed. I could really see that connection between, hey, if they're stressed, they're going to have TMJ, all that muscular dysfunction. So we can correct that. But if they're stressed, the problem's going to go right back. So I can see the connection to, you writing that book and just getting to the root cause. Why don't you just start kind of at the beginning? Did you always want to, be a dental hygienist? Were you always interested in lip ties? What's kind of your story?
I have always had a thing for teeth. So I didn't know whether I wanted to be an assistant, a hygienist, a dentist. I don't know, but I was definitely heading in that direction. So the mouth has always been my thing. And yes, I did start out with, a very minimal foundation because in hygiene school, in dental school, they don't really talk too much about it. They will gloss over ankylossia, which is a professional term for a tongue tie. And so it's interesting that I got into it because it really stemmed from my children. So as a mom of 4, I always say that when people ask, how are your kids? We always give highlight reel, in soccer, championship, ballet, all of the great stuff, right? But we don't ever really get into the nitty gritty of what's actually going on in our lives. And with my 4 kids, my oldest is my only boy, and he had a lot of issues with ADHD and behavioral and impulse control issues. My oldest daughter had issues with sleep. Every sleep issue under the sun, you name it, we were going through it every night for 10 years. We had bedwetting, night terrors, sleepwalking. I mean, you name it, we've gone through it. And then my younger 2 had a lot of upper respiratory issues and issues with breastfeeding and things that I wish I knew. And I wish I had you, Dr. Chris, when I had them when they were younger. But it actually wasn't until they were a little older, after I had been a mother for over a decade, that I had discovered that a lot of what their issues were all stemmed and rooted in what was going on within the mouth and the oral facial musculature. And so it is an incredibly important thing. Once I learned, I dove deep into it, and now I can't unsee it and I can't stop telling others about it.
And that's probably why people see you. There's a phrase in chiropractic by one of the developers of chiropractic, BJ Palmer. He said, early to bed, early to rise, work like hell and advertise, and it's like, it's not out of I want to make more money, but it's out of people need to know what we're doing here, So what led you to starting the Myospot? Had you always been an entrepreneur? Because I know dental hygienist, you're probably not having that much business school going through that certification program.
Exactly. There is no really business or entrepreneurial mindset. It was really once I saw the changes and the difference that were happening in my home, once we released the ties, once we got into the oral facial function, once we were really able to dive deep, I felt like I'd met my children for the first time.
Wow.
Like they were covered and buried under all of these issues. And then once we got all that off, they were able to really flourish and thrive. And so I really felt inspired. I needed to tell other people about this. I needed to do more. I needed to help the greater community and really spread awareness as much as I could, because I know that everybody might be answering the "how are your kids" question with the highlight reel. But if we start answering more honestly, we can really dive in and help change a significant portion of the population.
Yeah. I'm sure you get the same weird looks that I get when I say I'm a pediatric chiropractor and I work with kids that have autism, ADHD, all of that stuff. I'm sure you get the same looks, like I'm a dental hygienist that focuses in, all these different sort of things. What is the connection, maybe with the neurology or the diagnosis or the root cause of, these sort of neurodevelopmental disorders and the mouth?
Yes. So I want to say that everything kind of starts up in our head area, right? So everybody might think that, health and wellness is in the things that you eat and so forth. Well, yes, that plays a component, right? But structurally, I think that is the foundation of everything. So when we're talking about structure and developing our skulls, the tongue is really at the forefront of that. So our tongue should be able to rest up against the palate. It's kind of acting as the scaffolding for the growth of our maxillary arch, which, if we're thinking about that palate or the roof of the mouth is really just the floor of the nose. That is all one bone. And so if that's not developing properly and nice and big and broad, or if it's developing too narrow or high, then you have a really narrow, restricted nasal passageway. So some people are physically restricted, and so they can't get their tongue up there because of a tethered oral tissue, a tongue tie. Perhaps they're unable to close their lips, or as a baby, they have a difficulty getting a good latch, and so they develop mouth breathing later on because of lip ties. We have a lot of structural things that start down in the mouth in order to facilitate the growth of our nasal passageway, our upper respiratory system, and the foundation of life is breathing. Honestly, we can go for days without food and water, but we really can't go but a few minutes without air.
Yeah, and my mind is going from a neurological perspective. The vagus nerve, it starts right up in that area as well. I mean, you're seeing as intensive and invasive therapies as like vagus nerve stimulators, like electrical components going in to stimulate the vagus nerve, all the way to drugs like Adderall and Ritalin and all those different sort of medications that are kind of designed to either replace or artificially stimulate the function of the vagus nerve. And I can really see how if your structure is wrong, especially TMJ, especially latching issues, if that vagus nerve isn't being stimulated appropriately, this person's not going to have any parasympathetic or rest and digest function. Do you talk about that with your parents at all, or is that too much of a deep dive?
Well, first we got to get to the baseline where they understand, because I think we are so stuck in one certain mindset that, we can't really get over that. Yeah. But yes, once we start diving deeper, we dive into the autonomic nervous system, how we can regulate that, the importance of the tongue in stimulating the vagus nerve, in helping with digestion. Digestion actually starts in the mouth. Mm-hmm. So we need that tongue to palate connection. Those hypoglossal stimulators that you've mentioned, they're helping people with the sleep because it's stimulating that back of the tongue to keep it out of the airway. Most people don't even realize that the tongue is really long. It goes down to like C6, C7 on our cervical spine. I mean, this is a really long organ, and we need that to be up and out of the airway. We need it to connect. We need it to be stimulated with our cranial nerves. We need balance in order for us to function appropriately. So yes, we see a large connection with the rest and digest, the ability to, really wind down. Sometimes we find that large connection with the ADHD population and tethered oral tissues or mouth breathing. And so yes, there's a deep dive that we could take to go down that road.
You mentioned digestion. I don't know what the exact stat is. It's got to be probably over 75% of kids on the spectrum, regardless of, high functioning to not functioning very well at all, have some sort of gut issue, and parents spend thousands of dollars, if not more, on this supplement, this probiotic, this, new and improved, something or other. And improving digestion can start as simply as improving the way their bodies are actually able to mechanically and begin to break down and swallow the food, right? I talk about all the time, and I'm sure ear infections might be a big thing for you as well, that can help. But I talk about all the time. I see kids for ear infections every day. And what I talk about is that tensor veli palatini muscle, a TVP, works like your throat, where it's like a peristaltic, gentle drainage of fluid from the ear. However, if your nerves in your neck are stressed, that's going to tighten the muscle, which means that the fluid's going to build up. And when you have warm, nutritious fluid, bacteria is naturally going to flock, which means that you have pressure on the eardrum, and that's when you start to get inflammation and pain. You put a tube in there that artificially drains the system, and now you have this big bolus of bacteria infested, mucus, or whatever it is that goes down and infects the tonsils. And so then they start getting tonsillitis over and over again, and then they want to take the tonsil out, and it drives the infection deeper and deeper and deeper into the system until they're on 2 or 3 medications. Yeah, they don't have ear infections anymore, but now they have asthma, allergies, and digestive issues. How can you speak to these parents that are maybe like, okay, that's me, my kid started either with a traumatic birth, they didn't diagnose any tongue ties, I had lots of colic and pain, with breastfeeding and reflux. I'm interested in getting my kid, checked out. What does the procedure, typically look like? And then can it just be done in, little kids, or can it be done in any age?
It can be done at any age, just to answer your last question first. But when we're looking at it, I loved everything that you said about the ears. When we're looking at the drainage of the ear, you can actually drain your middle ear with your tongue if you are swallowing appropriately with that peristaltic motion, that tongue up against the palate. It helps to drain that middle ear naturally. And so we find that we're looking at the tongues, and when it comes to myofunctional therapy, we're looking at how they're swallowing. Are they swallowing with more of a tongue thrust pattern, where the tongue is either pushing forward or pushing against the teeth in order to get any sort of liquid down, as opposed to pushing against the palate, which is going to work with the palate on the vagus nerve and help to stimulate the digestion and help to drain that middle ear. We're not going to see all of these things compound, like you said, how it goes from that middle ear not draining to then now we have the tonsillitis. So we're talking tonsils and adenoids that have to be pulled out, and surgical interventions, gastrointestinal interventions. We can really look into the mouth to find out what's going on there to help connect those dots.
I love that. I think this is going to be an eye-opener for a lot of people that are listening, and we'll do all the SEO possible to get, people to find this. What if people are scared of, getting a tie released, or, something like that? What is the procedure like? Is it painful? What's the recovery like?
Well, it is a simple procedure, but it's a surgical procedure, right? So there are different ways that it can be done. And I know that people have a preference between laser or scissors and suture. However, honestly, what matters is that you go to a provider that does this and has been very well trained in doing this if you're going to get a release, because that's going to make you the most comfortable, just first off. Secondly, we want to make sure that we are prepared for pain management, because it's a surgical procedure. There will be some aftercare. You're going to have to manage your wound. You're going to have to manage some pain, but something as simple as an over-the-counter pain reliever can help make a big, big difference. I also tell my clients to stock up, and a lot of the kids love this, but stock up on all the cold things you can get. I think my daughter ate nothing but Italian ices and ice cream for like a week after she had hers. And that's all she remembers. She now tells me years later, she's like, remember when I had my tongue released? That was the best. I had ice cream every day.
Right. That's awesome. That's awesome. Yeah. A lot of my kids, and, especially my moms of newborns, where this is their first thing, I tell them, this is what we need to do. And, they're like, oh, a surgery on my baby. And I'm like, I mean, the one that I refer to out here in San Diego, she uses the cold laser, and it's like, man, there's no blood, there's no maybe a little bit of lidocaine on the lip, that's the only place that they're going to feel pain. Recovery is a day or two, especially when they're that little. I mean, they just regenerate, so quickly. There's natural pain relievers for people that don't like medications, things like arnica montana or chamomile, or what's the other one that I recommend? I'll put it in the show notes. I can't remember what it is right now. It's a yellow wrapper. You probably know what it is.
I'm thinking Rescue Remedy.
Yeah, Rescue Remedy. Yep, exactly what it is. Yep, the tincture. So there's lots of things too. If parents are like, well, I don't want to give my kid Tylenol, and like there's plenty of options for pain relief, no matter what side of the fence that you stand on. Why don't you talk a little bit about your book? What kind of gave you the skill, the insight, the passion for going further than just doing your 9 to 5 with your, I guess it's not 9 to 5 under entrepreneur, but it's just running your practice. What gave you that passion and fire to write the book?
I think my story and just knowing how far I came and feeling like I needed to make a bigger impact in order to get this word out to as many people as possible really drove me to write this book. So I dive deep into my story, where my kids were, how I discovered everything, how you as a parent or even an individual who may have grown up going through some of the things my children went through, and now you feel like, oh, I'm seeing how this has multiplied over the years, how this has compounded and become whatever you may be going through now, whether it be sleep apnea, or you're having difficulty with breathing, you're having still gastrointestinal issues as you're swallowing, you feel extra gassy. If you're finding that you're having some of the things that I talk about in the book that winds up to be back to the oral cavity, then it's a great time at any age to start to make those changes. So I go through a simple plan, how you can really start to make a change, because I'm one person, right? And there are probably less than 500 myofunctional therapists throughout the globe. And so that's not enough. We can't make a big enough impact. So I wanted to touch as many households as possible. And so that really drove me to write the book and to get people the education and the help that they need.
I can only imagine, knowing you and looking at the title of the book. It's I don't want to butcher, Accomplished.
Yes.
What's the rest of it?
Sleep better, eliminate burnout, and execute goals.
Right. So I'm thinking, like, if I'm going to pick up this book, I'm going to be learning about maybe healthy habits, like maybe some sleep hacks, those sort of things. And I'm starting to hear about tongue tie revisions and this and that. I bet it's such a eye opener for people, where it takes I don't know, a twist, not in a bad way, but it takes people in a direction of like, you truly never would have thought of this on your own unless you're exposed to somebody that has been through it, has walked through it, has done it, has worked it, with it day in and day out. And then you mentioned you help people globally. What type of things do you do online?
Teletherapy is a fantastic option. That is something that has evolved even more since we've been in this COVID age, and a lot of us are more familiar with Zoom, that we've become, as therapists, really, really good at our verbal cues and our verbal instructions, and trying to get these exercises, instead of doing like manually helping them with the exercises, we're actually able to get them to do them via teletherapy. So we're able to help strengthen and coordinate the orofacial muscles through distance learning, just teletherapy. And it's been a phenomenal thing to have multiply, because now we're helping people everywhere.
Mm-hmm. It's amazing. Now, do you, kind of like speaking to that, do you think everybody that has, some sort of, like, do you do a consultation over the phone? Like, hey, I think a tie or musculature, might be an issue for me. What is it? Can you do that over the phone? Or obviously not over the phone, but over a video conference?
Absolutely. We could do a
Wow.
consultation. So I always say that just because we see something that looks like it might be a tie doesn't necessarily make it a tie.
Mm-hmm.
A lot of times we have to think about the function. How are we functioning? And then really make that assessment. So I do look at oral facial function through consultations. Consultations are absolutely free. It's like a 15-20 minute appointment. We talk and then we go through. And then if we want to dive deeper, if I think that it's a good fit, we dive deeper with an examination. And so we go into that next appointment.
Yeah. And not all the time you find something, do you have to do a surgical revision, right? Sometimes you can do it through exercises.
Exactly.
Yeah.
Exactly.
So if somebody's listening and you're scared of surgery, no matter how benign and easy the surgery is, you can still benefit from doing exercises and knowing that that's your issue.
Absolutely. And manual therapy. I work with a lot of, whether it be osteopaths, craniosacral therapists, or chiropractors who get in there and who do that manual work. So I do the exercises, they do the manual work. And then, you guys are the real heroes. You help these patients get a lot of loosening of those, fascial systems and the muscles and all that strain and tension that they hold up there.
Yeah. I'm a believer. I mean, when I first got into this, honestly, I was a little bit skeptical of tongue tie, like just kind of the classic pediatrician, stick your tongue out or you're good, And then I don't know if you've heard of Team Tongue Tie. They're the people that I most routinely refer to out here in San Diego. She came up into the seminar for us and talking about like you sticking your tongue forward is one function of the tongue. You know what I mean? It's like you doing curls and saying my shoulder and elbow are fine. It's like you didn't test, 3/4 of what the tongue is actually responsible for, And so if you have any questions about tongue ties or, anything like that, this is definitely the right spot. She has a ton of resources on her website. Is it myospot.com?
Yes.
Yeah.
themyospot.com.
Awesome. And where can people find your book?
And so on Amazon, it's available. I try to make it as affordable as possible. So it's very, very cheap. It is accomplished. How to sleep better, eliminate burnout, and execute goals.
Awesome. Well, Karese, any parting thoughts for the audience before we sign off?
I would say my biggest thing is to advocate for yourself. I wish I knew more when I was, struggling with my children and struggling, just personally. I wish I knew more to advocate. Just advocate for yourself. If you feel like something's wrong and you don't like the answers that you're getting, continue to advocate for yourself.
That's so good. That's probably the best parting message we've had. I mean, it's because it's real. You moms and parents have those instincts. If something is not right, either about my kid or about myself, don't take no for an answer. Don't keep asking the same questions over and over again. Try to find a different angle that you might get a different response. But yeah, ultimately, our health is our own responsibility. Doctors may help us guide us there, but ultimately it's up to us to really advocate for us and for our kids. You've been an amazing guest. Thank you so much for jumping on. I'm so excited for people to listen.
Thank you for having me. It was so much fun. Thank you.
Thank you for listening to the Healthy Perspective Podcast. To connect with Dr. Bowman, follow him on Instagram @Dr. Chris Bowman. Until next time, make shift happen.